Hi, my beautiful people and amazing fans. If you're seeing my face for the first time, this is Sapphire Adeze. On this program, I talk about health, well-being, politics of great concern, and weekly declaration. So today I'll be talking about the male infertility. Yes, I'll be talking about the infertility in male. This has been a very big concern which nobody talk about, especially when man and a woman is looking for baby. The first suspect is the female. Most eyes are on the female. Oh, she could be the cause of the delay in pregnancy. There's the but no one look about the male. But in reality, 30 to 40% of the issue is the male, 30 to 40% of the issue is the female, while the remaining percentage is both of them. Yes, there are cases where the man and the woman has got issues. So no one is looking at those angles. So today I have come to address the issue, not just saying it's only the female. Everyone needs to check themselves and find out if everyone is viable, fertile for pregnancy. So, yes, just as I said, the percentage is the percentage is all around male and female and both, as I said. So it's partnership. So why is it that it's always the female that is being suspected? When it comes to issue of looking for a child, it's always the female that will go out drinking concoction, going from one prayer house to another. My mother-in-law, father-in-law, sister-in-law, everybody is on their neck. They taking one concoction or the other to get pregnant. No, that shouldn't be the issue here. So today we're going to look around how this play up. Yes, the one thing that we have not that need to be considered here that I've come to address is some men have issue with their sperm. Yes, for fertility of a man to be viable and effective, we have to consider the viability of the sperm. That's the motility of the sperm, the shape of the sperm, and the lifespan of the sperm. These are what contributes that makes a sperm a healthy sperm. But some men has got one problem either on the viability, that's the movement of the sperm. Say for example, people are doing competition. So this is a relay, we're doing a relay, this is a battle. You have to get to the to the last point. So now when the sperm moves from the man's body and moving to fertilize the ovum, some sperm don't get to their destination, they die on the way. Yes, they are not, yes, they fuse out on the way, they die on the way. So that's another form of infertility in the man. The man has sperm, but the sperm are not able to get to the destination, they die on the way. So there are tests that is carried out to search for such condition. So yeah, that is sometimes the sperm is too small. And another common reason is that another common reason that men struggle is the very common condition known as varicocele. Yes, varicocele. Yes, this is a medical language. It only means um before I go on, please, I will ask you, my fan, please subscribe, share, press the like button. You might be helping someone. Please help us, help subscribe. It costs nothing to subscribe. Today is a very interesting topic. Subscribe. I'm on YouTube, Facebook, TikTok, Instagram. So now, what is varicocele? Varicocele is just a swollen vein inside the main scrotum. You know this vein back of the lung called that is a varicose vein. When it happens inside the scrotum, it is known as varicocele. Yes. If you even give a man a small tap on the scrotum, it's very painful. For a few seconds, the man will be I don't know how to explain it. Because the testicles are extremely sensitive and have only skin protection. I don't know why it's so. Because if you look at the importance of the testicle, it should be an internal organ like the kidney, the liver, but it's outside because it doesn't like hot temperature. The reason outside that the testicle need to have a kind of temperature. It doesn't want hot temperature because of the sperm. If sperm is in a hot environment, it cannot be functional. So that is why God has put it in that environment, we believe. So yeah. Now inside that scrotum, there are veins that carries blood. In some men, those veins become enlarged, swollen, or twisted. That condition is known as varicose. Research has shown that about 20 to 14% of men have it. Some people will say, oh no, it can't be me. But you don't know where you belong to. So, with men who are struggling to infertility, the number jumps. So the most thing is that most men don't even know that they have this condition. So in men's testicle, blood flows in two directions. Blood flows from testicle to straight up. For that to happen, there's a valve that opens and closes to ensure that the blood continues. In some men, those valves becomes weak and damaged, that blood, instead of flowing up, it flows back. So blood is entering the testicle and gathered there. A lot of them cannot really move. It becomes congested. And this pressure will make the vein to swell up around the testicles. Most times it's on the left testicles, sometimes on the right, like a blocked pipe. So that's exactly what happened. So how does this affect fertility? First, it will affect how the testicle work. Testicle job is to produce sperm. In this condition, it will not produce quality sperm. It cannot function properly. When blood gathers in the swollen testicles, it raises the temperature high, like turning off air condition in a hot environment, in an environment that doesn't want heat. So when this continue over time, then there will be low sperm count because some of the sperm will be dying. Abnormal sperm shape, low sperm count, some sperm with large head, not functional. One side of the scrotum, you will notice, become bigger than the other. Sometimes the male will experience a dull dragging pain. Some people will notice swollen vein at the back of their testicles. Yes. While some just feel ordinary pain. Please, if you check your testicles, and you will find out the size of your testicle and see the difference. So check your testicles regularly. Check if some men will even experience no pain, no swelling, no vein, until they'll just find out and see that they are infertile. Different people with different symptoms. So please, my guys, my odogus, don't hide it. So I know that this is a sensitive issue. Some people keep it to themselves. They don't want to talk about it. They don't even want to tell their wife. They will hide it. Please consult your doctor. Talk to your doctor quickly. It's a very important situation. Don't ignore. Don't allow this woman to keep drinking all sorts of medication. Don't allow her to keep walking up down in search of what is wrong with her, all in the name of want to have children while you are the cause. So please, as two people who want to parent children, please work together to find the cause of any problem. Okay, there's something to hide. It always have a solution. Most time it has a solution, except if people don't come out on time. Remember, I always say in health, time is very important. In health, time is life. That is what I always tell people. In health, time is life. A minute, not a minute, a second can save life. So please don't wait. Don't hide it. Don't postpone it. Okay? Please, after watching this program, After watching this video, please share. Tell someone. You will help people. Okay? Share. You will tell people. You will help someone. So as you're watching this video, comment. You can even suggest any topic you want us to talk about. Okay? So please tell us. Tell me. I will advise you men anytime, just the way we tell ladies to palpate their breasts to rule out any that is to find out if there's any swelling. Please, men, please palpate your scrotum all the time. Palpate your testicles, and do it after a hot shower when the muscles surrounding your testicles have relaxed, because when hotness actually stretch your testicles, so it will help you to find out if there's any swelling in your testicles. Okay, especially after a warm bath. All right, I'm not saying go and take hot water and massage your testicle. The testicle doesn't want hotness, but you know, people use warm water to bathe, so that warmness relax the muscles of the testicle. Gently roll your testicle between your fingers. It should be smooth and firm, no hard lumps. Okay, carry your leg, open your leg in the mirror to check under of your testicles. If you see any swelling, do a sperm test. Don't wait. This simple habit will help you detect varicocele on time. Okay, it can even help you notice any kind of infection or skin infection, because some men do have some kind of fungal infection at the under that place due to heat, moist. So all this routine check will help you to find out those things on time. Time saves life. So they do ultrasound to check these things out. They take your blood, your sperm, sample of your sperm to check. Sometimes they do a procedure called varicocelectomy. If someone is having that varicose, to remove those things, it is safe and it works. It's not deadly. Okay, other tests are still there, but when you get to the hospital, your doctor will tell you which of the tests and which of the treatment is best for you, because every condition differs. So please, and avoid smoking and alcohol. If you're trying to boost your fertility, reduce alcohol and smoking. Increase your exercise. All right, so these tips will support your reproductive health. All right, the same way you are not afraid to look to find food when you are hungry. Don't be afraid to go and to hide. Don't be afraid and be hiding your sickness, especially in that sensitive part of your body. Delays can even cause infertility. When this condition is quickly diagnosed, it gets solution. So please share this topic. You'll be helping one Jambul or Jacob around. You can even be helping Mary to share to the brothers and partner. Please share. It's good to share. That is the whole idea of this program. I'm not doing it for myself. I'm doing it to share, to help people. That is why I'm here, to help. Thank you.